estrogen affects how your tendons heal and remodel, and this is why your tendonitis is happening when you're postpartum or perimenopause, because estrogen affects how your tendons and ligaments remodel and the metabolism. And what surprises no one is that there has been little research on estrogen and how it affects the tendons, but this particular article is going to review and summarize the information that is available. So let's say your estrogen is increased. It is going to change your ratio of collagen. You're going to be less stiff, so you're more likely to tear your ACL. You're more likely to have sprains and strains. And they are wondering, how does it affect the failure load and healing of the tendons? The three forms of estrogen in humans are estradiol, estrone, and estriol, with estriol being the predominant one. All forms of estrogen are derived from cholesterol, just so you know, because it is a steroid hormone. And the main source of estrogen are the ovaries and the placenta, but small amounts are also produced by the male testes, the adrenal glands, and via the endocrine synthesis by several peripheral cells and tissues, aka belly fat. Now, it's not enough to just have estrogen. Is how does the estrogen bind and how do we get rid of the estrogen? So the expression of estrogen receptors in tendon tissue, which that's the important part, is that you know that we have receptors where, right? So this is why when our hormones shift, why do we have all these widespread problems? Is because where are the estrogen receptors? So the estrogen receptors in tendon has been demonstrated for the first time as an estrogen receptor alpha in 1996 by Liu et al. Many estrogen-sensitive cells are expressing aromatase themselves and are therefore capable of synthesizing certain amounts of estrogen, even if they are independent of the gonads, like, for example, osteoblasts, which that's bone, adipocytes, and endothelial cells. Remember, if you are a person who has had breast cancer, you are put on what? Aromatase inhibitors, which such all the estrogen out of everywhere. And this is why joint pain happens when women are being treated for breast cancer and when they're on aromatase inhibitors. Just for the record, we should have known that, we should have thought about that estrogen receptors are everywhere in the bones and tendons, because duh, we knew this. Why weren't we having that epiphany? Anyway, carrying on. In the most important sense of this article, let me show you. So if women are given an estrogen-like compound, which is the ELC, it appears to counter the degeneration, basically, of type 2 collagen, which is the predominant form of collagen, the articular cartilage in your joints, right? So therefore, it could be of interest to test if higher levels of estrogen, so if we optimize estrogen levels, if it's protective of our joints. This could be explained because when you are pre or postmenopausals, as the estrogen levels decline, it leads to telomere shortening, and this affects the cartilage, the chondrocytes. So estrogen affects our tendons and our joints, and we need to talk more if estrogen-like compounds actually helps us prevent the breakdown of type 2 collagen. So estrogen is so important to so many systems. But did you know the cartilage? Did you know it? Because this is my favorite part of this whole article. So in structures that are researched with how estrogen affects certain tendons and connective tissue, basically the research for estrogen in women is on 3 pretty distinct anatomical structures, and I know you know this. The anterior cruciate ligament, so the ACL, the Achilles tendon, and in fewer cases, the patellar tendon. The ACL is the structure most studied due to its prominent role in knee injuries in young female athletes, because we do value athletes, as well as the known gender difference in the occurrence in knee injuries, because women are more likely to tear their ACL and women are more likely to get hurt post-ovulation, and it's a whole thing. But what if we talked more about frozen shoulder, plantar fasciitis, all the itises, but we know at least a few things. So tendons are a type of connective tissue, and it is like a spring. So it has to have a certain amount of tension, it has a certain amount of stiffness, and both of these need to be quite right so it can be as functional as possible. And so when the load is too great and maybe it can't withstand it, then it goes to failure and then it breaks down. And if we know that estrogen is causing either too stiff if the estrogen is too low, or too loose if it's too high, there are different types of injuries that can happen because of the failure of the tendon. And so short-term changes in ligament stiffness are also crucial and well documented during pregnancy, right? So we know when the estrogen is high, that ligament stiffness is affected. This is why women talk about like getting a bigger foot when they are pregnant, because that ligament is softening. The estrogen is high, so the tensile strength is different, and it's a whole thing. It has been shown that stiffness is on average considerably lower in female knee ligaments compared to males. This condition has often been related to the occurrence of higher knee injuries in female athletes. Other studies on the stiffness of tendons of the angular joint has been conflicting in contrast to previously mentioned findings. In general, besides the implication of gender-specific differences in stiffness, it has been noted that also the adaptation of tendon stiffness in reaction to physical exercise appears to be different between women and men, at least in an older age. Let me say that one more time. The adaptation of tendon stiffness in reaction to physical activity appears to be different between women and men, at least in older age. Because women do not remodel as well when they are postmenopausal, and their ability to grow bone is different. They're higher risk for osteoporosis. They're higher risk for failure of their tendons and tendonitis and overuse injuries because the remodeling isn't as well. So it is not surprising that their tendons can't adapt as well to the physical exercise, and they're more likely to get hurt, more likely to get tendonitis, more likely to have pain that impedes them from moving, which causes deconditioning, atrophy, being frail, more likely to fall,